I even had a patient once bring me in these like pictures of breast augmentations, all these like after photos. And like, I noticed everyone was wearing like the same kind of bikini.
Oh.
And I was like, and I look back, I'm like, this is an AI generated page. It wasn't even like real patients. And so these are the things we're trying to achieve when they're not even actually real patients. It's like crazy. She finally admitted that she had them done. That was even on an episode.
Oh my goodness, that
and they
took
were like,
how many
Kim was
years?
like, you need to just come clean now. Just say you've had them done.
Yes.
And then she did, and then she made her lip kits and made $1 billion.
Yeah.
So in the US, you cannot call yourself a surgeon unless you've done a surgical training program. Whereas here, there were GPs that were able to call themselves cosmetic surgeons, which I thought was insane. The whole thing of being able to call yourself a surgeon when you've done 0 days of surgical training is crazy.
Hey, how is everyone? Happy Thursday. I hope you're all having a fabulous week. And I promise you, your day today is going to get a little more fabulous because we are diving into all things plastic surgery. We're talking the good, the bad, and the ugly, and we're uncovering the truths behind your favorite celebrity transformations. We see celebs everywhere. They're on our TVs, on our mobile devices, but with social media, it is becoming increasingly more difficult to differentiate between what's real and what has been strategically enhanced. I mean, the celebs like the Kardashians are no stranger to Photoshop fails, but what's even more alarming is that we've seen some surgeons who have been editing their before and after photos, which is just wild to me. We are going to unpack it all in today's episode. But before we get into it, a very quick disclaimer. Any celebrity or influencer that is mentioned in the episode is simply a part of the conversation, okay? This is not a personal attack on anyone, so I don't want anyone filling up my DMs or Smile the Makeover Scoops DMs telling us this, that, and the rest, because we are here just to interview the experts and to give you guys all the information you need to form your own judgment. So let's get into the episode. Joining me today is Dr. Angie Taras, a renowned American board-certified general anaesthetic surgeon with extensive experience in both the US and Australia. She has completed a fellowship in aesthetic surgery, bringing the latest innovations from the US to Melbourne. She's highly experienced in breast and body rejuvenation, including breast augmentation, abdominoplasty, and liposuction. And I am so thrilled to have her on the podcast today. So welcome, Dr. Angie. Thank you for being here. I have read so much about your background, and I'm so fascinated. First of all, you've got this beautiful American accent. You're making me sound very Australian today. Tell us about your early beginnings. You were born and raised in the US.
Yep. So, and I'm an American. And then I moved here after meeting he's now my husband. He was my boyfriend at the time. I met him in Chicago through his cousin, who was one of my good friends. So I moved here in 2015 after dating him for about 1.5 years. And then, I've been there ever since then. So it's been about 9 years that I've been here in Melbourne.
Amazing.
We got married, have 2 little girls.
Beautiful. How old are your girls?
4 and 6.
Gorgeous.
Yeah.
I read that you had a practice in Chicago.
I did, yeah. So I had graduated from general surgery, and then I did additional training in cosmetic surgery, and then moved to Chicago. We kind of move around in the U.S. People don't really stay home, so we go away for college, and so I was kind of all over the place. Came back to Chicago, and then was doing general surgery and had set up my practice then too.
How long did you have your practice for?
About 2 years.
Okay.
Yeah, and I had to kind of shut it down. So it was a big decision to come here and leave my practice that I was working to build. But I've got a practice here now too. So yeah, it's all worked out, which is good.
Why did you move to Australia? I mean, Australia is obviously a beautiful place, but
it's a beautiful place. But why would an American leave the U.S.? Because we all think it's like the best place on earth. Because my husband, brought me over. But it's nice. I like it here. It's a nice place to raise a family, and I've been enjoying living here.
It is beautiful. And your inspiration to pursue plastic surgery, I mean, you've been doing this for a long, long time. Why?
That's funny because I was thinking maybe to be a breast surgeon to specialize in that while I was doing my general surgery training. But one of my senior residents had gone and done an elective rotation in cosmetic surgery, and she came back and she's like, "Oh my God, you've got to do this. It's amazing." And so I went and did a couple elective months in it, and I just loved it. So it's just kind of, I like the attention to detail in the cases. So when you take out a gallbladder, no one really knows how well you did it. It's just, everything happens inside. But with cosmetic, you really have to be careful how, everything looks on the outside. So it's, challenging in that way. So I just really enjoyed it. I thought it was really fun.
Do you have a favorite procedure to do?
I like doing a lot of breast.
Okay.
Yeah.
Why breast?
It's funny. I've always had an interest in breast surgery. I always liked working with women. And that's why I was thinking to maybe do breast surgery after my general surgery. And so that kind of just fit in. So I like that even general surgeons who do breast pay attention to the cosmesis of things. Like they're careful where they're putting their incisions. And most general surgeons don't really care. They just, you need a bigger incision. You just make a bigger incision. So I liked that aspect of breast. And that's why I think that kind of, led for me to think about doing cosmetic as well. And I like working with women. So it's quite nice. I have, my female patients and working with other moms who've had the same changes in their bodies as, all the rest of us. So I think that's, I just enjoy doing work on the breast.
I love that. And I think what you said about working with women is so important. And I mean, particularly as a woman myself who has considered plastic surgery and cosmetic surgery, I'm always looking for other female plastic surgeons. But in Australia, unfortunately, we do see a lack of female surgeons. I think there's only like 13.4% of cosmetic and aesthetic surgeons here, and the rest are male, right? 86.6%. Yeah. That's a whopping difference.
Yeah, it's a huge difference, isn't it?
Why the gap?
That's a good question. I don't know if it's because of the training's pretty rigorous, at least in the US. I mean, here too, they do a lot of years of training. The setup's a little bit different, but you do have to sacrifice a lot. I mean, I didn't get married until I was like, 40. And my first kid at 41. It's like you really do, spend a lot of your early years just being in school and then, in a hospital, and then getting your practice going. So I think maybe that deters some women not to at least pursue a surgical specialty if they become a doctor. And that's, but, cosmetic, at least it has a nice schedule. The schedule could be a lot worse. But yeah, it's interesting. I don't know. I think there's a lot more women going through like medical schools now. So I think it's starting to become more even, but there probably is still that discrepancy in the surgical specialties.
I think your point around, and I mean, you're a mum yourself as well, and you lead this very busy life, balancing or trying to strike that balance between being a mum and, giving your family and kids enough time, but also, your patients too. I'm sure that demanding nature of the role would be tough at times too. How do you try and strike that balance?
Just yell at my husband a lot to pitch in, basically.
That always helps.
Yeah.
That always helps.
It's tough. So I don't work full time. So I kind of made that decision that I'm not going to work full time. And so I pack like kind of long days in less days of the week. And you just need someone who's I just need some help. That's basically it.
I think the support is a big part of it. And to have that is really important. What does an average day in the life of Dr. Angie Taras look like?
So I actually have kind of engineered my schedule where I have I do everything on Tuesday, Wednesday, Thursday, and then one every other Monday. And so I just operate in the mornings, and then in the afternoons I consult. And the operating rooms that I operate at are adjacent to my consultation rooms, so it's pretty easy. I just walk on over. So that's how I've done it. So basically just go in the morning, operate on my patients, and in the afternoon I see my post-ops and see my new patients. And that's it. And then I just do a lot of admin stuff, while I'm at home. And I rely on my nurses and my staff to help me out. So the team's just so important. Like I just wouldn't be able to do it with my team. And it's all girls in there. I've got two female nurses. I've got my amazing receptionist who just runs the joint. And
girl power.
Yeah.
Love it.
I just, you need help. Can't do it yourself.
For sure. What does an average consult look like? Let's say I was coming into your practice and I wanted to undergo some surgery. What does that look like?
So we just try to make it really relaxed. I think patients come in and some are like really nervous. I'm like, oh my God, this is like the most fun consult ever. It's not like you're going to the gynecologist. This is like talking about boobs and, trying on sizes. So if you come in for like, say, a breast augmentation, we would just talk a little bit about what you were looking for, and then we do some sizing. So we put the post-op, like a sizing bra on, and you can put some sizers in that the company gives you to just see what volume you like.
Oh, how fun.
Yeah. Patients love it. It's super fun.
I've never had a breast consultation, but I feel like I would love to just, I know, maybe I should. I can try one of those bras.
And then we just show them a bunch of before and afters that we have, and then talk about the procedure. And then they go straight after to see my nurse and practice manager, and she does all the, quoting and the scheduling and all that, the logistical things. And then you've got to do a second consult now with the regulations that have come out in 2023. And so we do that, as a second consult. They can ask whatever questions they want because they always end up Googling after they leave to check everything that we've said. And they always come up with more questions. So it's just a very relaxed experience. I want patients to feel really comfortable. Our office is just, it's almost set up like a living room. It's, it's very non-clinical because I don't want patients to feel like they're coming in to see, and it's surgery. There's risks, and we talk about all of that, but I don't want them to feel really uncomfortable because it is weird taking your clothes off and telling people things you're self-conscious about.
Yeah. It is a bit daunting. And I think, there is so much information out there that it also can be really confusing
there's
for
just
people
so much.
too.
And there's so much like wrong information out there. The amount of things people have brought me to look at. I'm like, where did you find this?
Yeah.
It's completely wrong, you know?
What's the common or most common age of patients that you see?
So I end up seeing probably a lot of, I feel like it's in a couple of peaks, I guess, like either the really young girls, like in their early 20s, most of them want breast augmentation. And then I start seeing a lot of the moms who have finished their families and now are trying to rejuvenate their body to what it was like before they had kids. So that's usually the two main groups. So those are probably the women who are late 30s, you know, early to late 40s as well. That's the second group that I see.
I'm interested in the young group of women that you see. I think, you know, Hollywood and social media for such a long time has played a really central role in shaping beauty standards, and movies like The Substance. I don't know if you've seen The Substance with Demi Moore.
I haven't seen it yet, but I've like seen.
Have to
I
watch
heard it's
it.
amazing. It's on my list.
Unreal with Demi Moore and Margaret Qualley, and I think that movie particularly amassed critical acclaim.
Yeah,
and
she won a Golden Globe.
She did, and I'm sure that she's on track as well for, you know, so many other awards. But it went viral because of that really graphic commentary and very spot on commentary about society's beauty standards and the pressure that's placed on women to look a certain way. You know, how many people step into your office on an average week and show you photos of celebrities and ask you, I want to look like them all the time?
Yeah, people just they show inspo photos. And so we always have to really make a point to say, listen, these are inspirational photos. You can't copy what someone else has because everyone's body is different to start with. And so it's going to be different after they do something to enhance it. And there's just so much filtering online. I feel like Instagram has made our job so much harder now. I even had a patient once bring me in these like pictures of breast augmentations, all these like after photos. And like I noticed everyone was wearing like the same kind of bikini. Oh. And I was like, and I look back, I'm like, this is an AI generated page. It wasn't even like real patients. And so these are the things we're trying to achieve when they're not even actually real patients. It's like crazy.
AI adds a whole nother level of complexity to the situation. I mean, how many of these transformations are realistically attainable? Are there elements of it that you look at and say to patients, yes, I can get you this? Or
we're just really honest. You just have to be, because you're going to end up with a really unhappy patient, and no one wants unhappy patients walking around because they will tell 1,000 people.
And they'll write Google reviews.
And so,
all that fun stuff.
Yeah, we just want to make sure everyone's expectations are really realistic. And if they're not, sometimes I turn people away. I just say, listen, I just don't think we're the right clinic for you to get you what you're looking for. You know, that's kind of the way we tell the patients, you know, because you don't like to, you know, you want to try to help everybody, but, you know, sometimes you just got to, it's looking out for them too. They're not going to be happy if you're going to get that vibe from them.
Absolutely. I have no issue with cosmetic surgery, plastic surgery, celebrities, influencers, people doing it. Where I think the issue gets really sticky is the lack of transparency and deception. You know, you see some celebrities or influencers credit their transformations to things like, oh, I just drink more water, or I just have a new skincare routine. I mean, J-Lo for years, right? She has said, oh, I just use olive oil on my face. That's what my grandma told me to do. And I think that those kinds of narratives have really skewed beauty perceptions and have made people chase really unrealistic expectations. And so you have those situations where people come in and they're showing you photos without knowing the real work involved.
And they feel really bad about themselves. They're like, why does she get to look like that when she's in her 50s and I look like that? You know, and it's like they don't actually look like that.
For sure.
You know?
Do you think celebrities or influencers should be honest about the procedures?
See, it's tricky because they might be like, well, it's none of your business to even ask me what I've had done, because that's really private. Some people are really vocal about it. Like if I have something done, I don't care. I show up to work, I've got bruises all over my face. People are like, oh, what'd you have done? I'm like, oh, I had that, you know, like it doesn't bother me. But then we've got patients who are like hiders. You know, they have something done and they like won't leave the house until they're completely healed. So everyone's just so different. And it's just a personal decision how much you want people to know what you've had done. So I think people probably shouldn't even ask in the first place. Yeah. But then if they do ask, you're kind of stuck in that, like, what do you do now? You don't want to admit that you've had stuff done. But you also probably shouldn't lie because it creates these unrealistic expectations for people. So I think it's just really tricky.
It is tricky. And I think celebrities and influencers fall into a slightly different bucket too because they are in the public eye.
Yeah, they're broadcasting everything.
They're broadcasting everything. And I think people also look to them as, you know, role models in a sense too. And so I feel like the average person would think to themselves, they should be honest. You know, I want to know what they've got done.
I mean, you're making money by being super public.
You are.
And if you are going to publish that, you know, do you get to choose what you make public? You know, that's, you know, kind of the question.
For sure. And there's celebrities who deny plastic surgery. So things like for example, people will accuse them of I've never had Botox, they'll say, but they've had other similar toxins injected into their skin, things like Dysport and other stuff.
Yeah.
What about if someone says, I've never had lipo or a tummy tuck?
Yeah.
What's something else that they could have done that's not
Well, there's a lot of
lipo or a tummy tuck?
non-surgical things that you can do now. And so, people, it's just not a big deal to admit it. Like, at least for me, but we're in the business. So for us, it's like, who cares? You had some Botox. It's like moisturizer to us in the clinic. Everyone has had, it's no big deal. So there's lots of like non-invasive, like the Morpheus and Potenza, like the RF microneedling, those kind of devices. So there's other things you can have done. And some are more invasive where you still have to get a general anesthetic and they do some skin tightening while you're in the operating room. Yeah, but are they going to admit it?
Yeah. I've seen on some episodes of the Kardashians where the girls will do like cool sculpting or things like that to get rid of, excess stubborn fat. And so if Kim's ever been accused of getting a tummy tuck or something, she's like, no, I haven't had a tummy tuck. But
not, I guess,
unless you watch the episodes, technically, that's the thing. If you want to play technicalities. Exactly. We're going to play a fun game now called Guess the Work, okay? Yeah, I'm going to show you some before and after photos of celebrities, and I want you to tell me what you think that they've had done. So for everyone at home, we're pulling them up on an iPad here. We will pop this on screen for everyone to see. First one here is Bella Hadid.
Yeah, well, the obvious one, she's had a rhinoplasty.
It's very obvious.
Not a subtle rhinoplasty at all. Definitely looks like one of the, LA ones where it get it as small as possible and,
Very, very narrow front and beautiful, cute little tip.
That's right. I think she looks really, really good. I'm all about people enhancing. She's had her lips injected. Obviously, her top lip is definitely fuller than it was before. Even her bottom is as well. And the ratio is a little bit better now.
What about her eyes? A lot of people have said that she may have had like a...
Yeah, we could do you can get thread lifts. So basically you just put some threads in to give you that cat eye. Those do dissolve. It's not technically surgical. It's still a non-surgical treatment. It doesn't last very long, but a lot of celebs I'm noticing are having that like really lateral lift on their eyebrows.
It's quite drastic, isn't it? Some of them I've seen really, really pointy and others are quite
But it comes
natural.
down pretty quickly.
Okay.
They don't last a super long time. Usually about like 3-ish months, maybe a bit longer than that. So she may have had that too. Those are pretty easy to get done, so I can't imagine.
She's beautiful though.
Yeah.
I do love Bella Hadid. Lindsay Lohan.
Yeah, she definitely looks... I just saw a show that she was in, like that Christmas special.
Yes, on Netflix.
She looked pretty done. Like this picture, she looks, I think, really good, but definitely lips. And I think she must have tweaked her veneers as well.
She's definitely done her teeth. In these photos you can see. For me, it's just...
the nose looks a bit...
Her nose looks a little bit done. Also, her eyes, though, again, she looks really awake in this photo.
Yeah.
I wonder if she's...
And her brows are changed, so her brows are thicker now.
The brows do make a big difference as well. I've heard, though, people say that she's had a facelift.
Gosh, she's pretty young.
She is young.
I've seen patients who are, 39 and have had facelifts already, so she may have. You can do thread lifts.
Yes.
But again, those don't last super long either. About 6 months, they usually they just don't have the longevity.
Yeah.
So maybe a mini facelift. Oh,
Donatella Versace.
What hasn't she had done? That's probably
what hasn't she had done is the question. Go on, tell me.
Oh my goodness, her lips for sure would have had a facelift, fillers. My gosh.
Something really bad has happened to her nose.
Yeah.
Though. Is that, do you think, overdone work?
Yeah.
Too much?
It's weird. It's almost like it doesn't even look that much nicer to me. I shouldn't say that. I don't like saying unkind things. But it's still a little bit bulbous in the front. It just looks different, like something has been done, but I don't feel like the result's that nice of a refined nose. But you can tell she's definitely done her lips. She's done something because her whole face is getting pulled and her mouth is looking really long. If you put too much filler on that upper lip, you can get kind of that sausage look where it gets really flat and long.
Yes. And the last one here is... Kylie Jenner. Yeah. She is always in the news. People are always talking about procedures and work that she's had done. Where do you start with her?
Obviously the lips, everyone knows that. That's how she made her
queen
fortune.
Of the lips, yes.
Like, good for her. She finally admitted that she had them done. That was even on an episode.
Oh my goodness, that took how many
Kim
years?
was like, you need to just come clean now. Just say you've had them done. Yes. And then she did, and then she made her lip kits and made $1 billion.
Yeah.
So
I remember when those lip kits came out.
Yeah. You couldn't get them. They were selling out in like 10 minutes.
Crazy.
Yeah, that's
Everyone
right.
wanted the lip kits, even myself included too. Even if the colors are a little bit ugly, I was like, I just want a Kylie lip kit.
It's so funny.
So yeah, definitely her lips.
Yeah, it looks like she's had fillers. Her nose, I think most of them must have had their nose done, but she looks like she's had a rhinoplasty as well. Her brows have changed.
Yes.
So I don't know if her eyes look different just because of her brows being a bit thicker and that ombre look that she's got to her brows now. And I'm sure they've had Botox and,
Absolutely.
Yeah.
Did you see the photo of Kylie at the latest Jean Paul Gaultier runway? We'll pop it up on the screen for anyone at home. So Kylie has never actually admitted to getting a breast augmentation, but
she did in one of
in
the
this.
last episodes.
Did she?
Yes.
In a recent one?
Because she was saying she felt like she should maybe
Okay.
take them out. So I think that there was recently. I like the Kardashians.
I do too. I'm watching season 6 at the moment.
Yeah.
So.
I just like that they've changed the body type in the U.S. to be, I mean, even here, like in the U.S., we kind of like curvier bodies, because we have a lot of African-American women who have like big butts and, but here it was always, when I first moved here, I was like, everyone's tall, blonde, and skinny. Like I just really noticed it.
Yeah.
And then now people are doing more of that curvy. It's more of an attainable look to get that curvy Kardashian look than it is to be like Kate Moss. Yep. So I like that they've changed that quite a bit.
And I think to your point, the beauty standards also differ depending on, what region
country,
you're from or what
100%.
country.
Even in the U.S., like in the South, you get big boobs when you get implants. We used to do huge ones when I worked down there. And then like in New York and Chicago, they're smaller.
Yeah.
They're not as obvious.
I think with Kylie Jenner and even, celebrities like Molly May as well, I'm not sure if you're familiar with Molly May. I watched a recent episode in her documentary and she was looking at old photos where she had done a lot of really overfilled work. She had a lot of filler in her face and she was saying how she didn't recognize herself. And I think we've seen this era of fillers being so popular for so long. But I almost feel like in recent times we've seen a really dramatic shift where girls now are going or women are going the other way.
That's right.
Do you think this is a trend with this anti-filler movement? Girls getting their filler dissolved?
Totally. It totally goes in waves.
Yeah.
Like we get people now who all want their breast implants taken out and people are doing way more natural enhancements. They don't want that pillow face. They don't want like, that real puffy look. Even with like the BBLs, like the Brazilian butt lifts and the fat injections and everyone's buttocks, the Kardashians have slimmed down. And so their butts and boobs aren't as big anymore. And now everyone's not really looking to that aesthetic. It's totally goes with the trends.
What's the main reason that people would come to you and get their breast implants removed?
Yeah, a few reasons. So if they sometimes implants can have issues if they rupture or if they bottom out, meaning they start falling too low, then they need revisions. And sometimes people are like, you know what, forget it. I just don't want to deal with them anymore. And they just take them out. Or if they have breast implant illness symptoms, sometimes you can feel unwell when you get implants put in. It's not very well described and we don't know tons about it. And so patients are like, I just need to take these out because I don't know what's going on. Just take it out of the equation. So then we take those out. So, and then people have like big implants in. A lot of them want to downsize now. Like you said, it's with the trends.
It's just so hard to keep up though.
Yeah.
And if you're someone who is, always on social media or looking, you're doing one thing, getting fillers, getting your boobs done, and then the next year girls are getting them removed. And it is really, really tough to keep up. With social media though, and I do want to touch on the ethics side of it a little more, it's a really powerful tool for individuals to promote themselves, for businesses also to promote themselves too. I think every business now is on social media
accounts for our practices. Yep.
Cosmetic practitioners using social media to promote their businesses is fine. Where it gets a little bit tricky is with the algorithms now on these platforms are so sophisticated and they're highly researched and they're deliberately targeting, specific audiences that they know will resonate with that content. How do you balance ethical concerns with marketing your own practice on social media? Is there a fine line between exploitation and promotion?
Yeah. We just make sure that first of all, you have to get permission from the patients. So that's like a whole new thing now with Opera. You have to ask the patient, is that okay if we use your photos? And you have to say for what you're using them for and all of that. So that's number one. And then number two, they have to be, you can't filter them. There were so many sites that I would look at. I'm like, these people, everyone's filtering their after photos. Like, you can't do that. So just no filters. They have to be completely genuine before and afters. And really, you kind of have to have an Instagram. It's like, even if you go to a restaurant now, people look at the Instagram before they go, to see if the food looks all right.
I do it all the time.
Yeah.
I always jump on like the tagged post to see
that's right.
who's been at the restaurant. Because Google reviews, I think, used to be, the craze. Everyone was reading Google reviews, and now people are using social media to see pictures.
And it's like you're running a business. Like, we are, taking care of patients, and patient safety always comes first. But, you also need to show people what your work is. And so you have to be showing these before and afters. And so now we've got social media. Before it used to be you had to make a consult appointment and we'd show them during the consultation. Now we can show them before so they can decide if they even want to come see you in the first place. Yeah, so I think you just have to be really, and Opera's totally hammered down on this. Even if you've got arms, like we had to take down a bunch of ours because back then someone could have their arms straight down in a before. And then after, if they happen to just stand with their arms behind their backs, technically you can't use that. They're so particular about it. Yeah, it's pretty strict. So they'll say, well, that's not portraying, you have to be in the same position from the same distance.
Okay, I didn't know that.
We've got markers on the ground, like a whole photo room set up to make sure that we're really, really compliant.
Wow.
Yeah, so if people don't want to do it, they pretty much have to now. Otherwise you can get basically regulations.
I know that there was a crackdown last year.
Yeah, big time.
With deceptive social media posts by cosmetic doctors, and to prevent, deceptive advertising and to help protect consumers from misleading claims. And I guess photoshopping images, though, as a cosmetic practitioner, that's pretty bad.
That's really bad. Yeah.
Well,
we don't do it. I don't even know how to use Photoshop.
That's good. Keep it that way. But I think, I consider myself as someone who, does my due diligence and researches and will try and get lots of different opinions. But I am a very visual person too. And I do like looking at before and after photos. And I couldn't imagine being someone who is going to see a surgeon or a doctor and is pretty much being lied to.
Well, I don't think the surgeon's doing any favors for themselves because now you're going to be held to this standard. Now you better produce these results because everyone on your Instagram is looking this good. And then if you don't, you've got an unhappy patient on your hands, which is a big problem.
And what about unqualified practitioners or doctors? Because I have read and seen so many horror botch stories of these doctors offering invasive procedures like boob jobs or BBLs, and they're labeling themselves as surgeons. Can you explain what is the difference between a plastic surgeon and a cosmetic surgeon, and where is this loophole?
Yes, I think the big thing was when I first moved here. So in the U.S., you cannot call yourself a surgeon unless you've done a surgical training program. Whereas here, there were GPs that were able to call themselves cosmetic surgeons, which I thought was insane. I just didn't even know that existed. So that's the first thing. So that's been taken away now, so they can't do that. But then the difference between cosmetic and plastic surgeon. So I did the cosmetic route. And so in the US, you start with a surgical specialty. It's like general surgery. It could even be like obstetrics and gynecology. You can even be a urologist if you want. And then you decide if you want, so you finish that first. So that's like your first thing. And you get board certified. And then you can go on to specialize in something else. And so the specialty can be plastic and reconstructive surgery, or it can be a cosmetic surgery fellowship. And so the difference between the two is the plastic and reconstructive, they do a lot of recon surgery, which is like, hand surgery and burns, craniofacial, which is like fixing cleft lips. And then they can also do some cosmetic stuff. Historically in the US, the training for that doesn't include a lot of cosmetic surgery, because if you imagine if you're in the public system, you're probably not going to be putting in breast implants and doing a lot of liposuction.
Sure.
You do breast reductions, you'll do like abdominoplasties, that kind of thing. And so the cosmetic fellowship was there where it was just purely cosmetic procedures. And that's all I did for the year. I did like 600 procedures, really, really busy. I was like more of a slave that year than I was in my like 5 years of general surgery training. Yeah, so it was really busy. So that's kind of the difference. Australia is a little bit different. In the US, to do that cosmetic surgery fellowship, you had to finish a surgical training program. So I had to be done with my general surgery. I had to get my board certification, and then I could go do that. Here, you don't really need to. You can go through some of the program, the surgical training program. You have to do the basic surgical training years, which is usually about 3 years or so, and then you can go and do the fellowship. So but you can't, it'd be nice if it was two separate specialties. But the way it's set up, cosmetic surgery in Australia can't be its own specialty because you need to have a burden of disease is what it's the AMC, they're the ones that credential all these training programs said. And you don't really have a burden of disease when you're treating cosmetic surgery patients. Okay. So that's kind of like the thing now is to try to figure out how you can kind of separate it out. So now there's this endorsement process that's going on. So for anyone who hasn't done the plastic and reconstructive fellowships, then they can get endorsed for cosmetic surgery. Even they can too, even plastic and reconstructive surgeons can. And that'll be an extra little thing on our registration that says I am, endorsed for this, group of procedures.
Sure.
And it's safe for patients to come and see me. So that's in the process. It should be happening shortly.
Wow. It's just wild to me though that
the whole thing of being able to call yourself a surgeon when you've done 0 days of surgical training is crazy.
And how scary for the people who have undergone those procedures and then woken up and have had complications and, sickness or illness from it is just crazy. I do want to touch on a little bit more of, ethical plastic surgery, but where it concerns children, because I know that you're a mum yourself and you have 2 beautiful little girls. What is your philosophy with children and plastic surgery?
Personally, in our practice, we don't treat anyone under 18. There's a couple procedures I think would be just fine, like otoplasty, pinning back ears, that kind of thing for young, for kids, I think can be really something that can really improve their lives. I don't personally do them, but that's one thing where I think that would be okay. So there are a couple little procedures. Now, are you going to start, talking about doing breast augmentations on 17? Like, no way. You know what I mean? Like, for me, I think you're just not old enough to make a mature decision about it and really understand, the risks of it. That's just my philosophy. Maybe other people would disagree with that. But yeah, you've got to tread really carefully with kids because they're like
they're
surgeries and they're young
and they're impressionable.
It's like not, reversible, some of these things. You know what I mean?
Yeah. But I often think about the age that we're living in though. And, we're seeing children younger and younger.
So fast
they
now.
do grow up really
crazy.
fast. I look at, my cousins, now they're 17 or 18, but even, years
just
before
the stuff
where
that they wear. I used to roll around in the mud or on like a basketball.
Little crop tops and, boobs pushed up to the ceiling. First of all, I didn't have boobs even at 15, right? So, but it's just crazy how fast they're growing up and how much they're being influenced by what they're seeing.
I'm hoping Instagram goes away and like social media before my kids get that age, but it's not going anywhere.
And then demanding their parents to,
to fork
at
out
16,
the dough for
they're
it.
wanting to get their lips done. What about non-invasive cosmetic treatments for children?
Gosh, even that, fillers, you can still have complications from fillers and, I guess I'd be a little bit more lenient on those. But where do you draw the line?
Where do you draw the line?
You get them a little bit of Botox. And now I want to get my lips done. Okay, now you got your lips done now. Well, I want to get my cheeks done now. So I don't know. It's a slippery slope, isn't it?
And how do you think surgeons, as we see this growing demand over the years, will balance that with the mental health of young patients?
Yeah. So, we have to do a body dysmorphic disorder screen on everybody now as part of the new regulations.
Right. What does that look like?
It's, we have one that we got from a psychologist, and there's a couple standard ones out there. And so we just use that. Everyone has to fill it out. And if you score high in it, you have to have a referral to a psychologist to get a letter of clearance to have the procedure done. And we have a really good one that we use that we send patients to, and she'll just be like, yeah, I think they're good. They're okay for it, understand everything. And other times they're like, I just don't think this is a good candidate for surgery. So I think you just have to, when you speak to people, the red flags will start popping up sometimes. You can I
was going to ask you, what are those red flags when you have patients come into your clinic?
People have had lots of procedures from lots of different practitioners and, hate some of the doctors and like, no, I think you're going to be the best. You're going to fit. And I'm like, oh no, like I'll be right along with the rest of them because it's something, no matter how perfect of a job you do, if someone's just not happy with themselves, they're not going to be happy with your work. It's just, you're just totally going to fail. There's no way you can succeed. So, you have to just kind of try to weed them out. Sometimes they slip past you. And
in that case, would you rather turn a patient away and not?
100%.
Okay.
Yeah. Or we just say you have to have a clearance from a psychologist. And they can usually tease it out too.
Crazy.
Yeah.
Look, I think it's great, especially for young children, that there is that screening practice in place because otherwise, I'm sure that there would be many surgeons out there who would just want a quick cash grab.
Wait period too for kids. I think it's 3 months because we don't do them. I think it's 3 months. So like if they see you in a consultation, they cannot have any procedure done until that like cooling off period has occurred.
Wow.
It's 7 days for adults after the second consult, but for kids, I think it's 3 months.
Insane.
Yeah.
We're going to close the segment today with a bit of a fun this or that. So I'm going to give you 2 options and I want you to tell me which one you like the best. Ready? Question 1, going out or staying in?
Oh, God, staying in.
Are you a homebody?
I used to not be. Now I am. I'm just tired all the time.
And you've got the kids
That's
too.
so much
You probably just want to chill
I just
at
put
home.
them to bed and I'm like, I cannot get into my bed fast enough to turn Netflix on. Yeah.
What are you watching at the moment?
Oh, the O.J. Simpson.
Okay.
It's so weird. I watch all these weird documentaries. And the Kardashians because they're coming out.
Love the
next
cars.
season.
Silver or gold jewelry?
I'll say gold.
Gold. I feel like gold is really in.
Yeah.
All the young cool girls are wearing gold. Fillers or Botox? If you had to choose one.
Oh, God. That's a tough one. I'll say Botox.
Botox?
Yeah.
Coffee or tea?
Tea.
She came in with her Starbucks today. I thought it was coffee. It looks like coffee.
My
It's
Starbucks
not.
iced tea.
Tell everyone what your go-to Starbucks
I
order
get
is.
an ice shaken black tea at Starbucks, and I'm pretty sure I'm the only person in Melbourne that orders this.
It's very American.
Yeah.
How American of you. Natural teeth or veneers?
Oh, veneers. I've got veneers. Yeah.
We love beautiful big white teeth. Music or podcasts?
I'm actually to the podcast now.
What are you listening to at the moment?
Oh my God, what was I just? Oh, this it's called Love Janessa. It's
Okay.
this catfishing.
Oh, I love a
people-
catfish
yeah,
story.
yeah.
I'm so into
And
that
the
stuff.
Diddy and the Diddy thing.
Yes.
The Diddy child. I've been listening to that.
Yes. Fiction or non-fiction books?
Fiction.
Movie date or dinner date?
Movie date.
Overseas or interstate travel?
Oh, I'd say overseas.
Overseas?
Yeah.
Favorite destination?
Yeah, we like going to Europe. Anywhere in Europe. Yeah.
Where's your favorite place in Europe?
Well, we're Greek, so we go to the Greek islands.
I'm Greek too.
Are you?
Yes.
Oh, it's going to tell from your name.
There we go. I know I have it's a French first name and then it's an Italian surname. So I'm half
no
Greek, half
way.
Italian, but there you go.
Oh, how funny. Yeah.
Do love Greece. Maybe I'll see you in June
Yeah,
dancing
we
on the
do.
tables in Mykonos.
Yeah, I know.
Catch you there. And last question, gym or spa?
Oh, God, the spa.
I do love a spa.
Yeah.
Do you train? Do you keep fit?
Oh my God, I try. And there's no chance. No.
You look
I don't really
beautiful.
like to sweat, really.
Oh, I hate
I'll
sweating.
do some Pilates, that's my go-to, but no. I just don't have time. I would love to. That means someone would have to help me take care of the kids because,
Yes.
I can't leave the house.
Can't do it all.
Yeah.
Angie, thank you so much for coming on the show today.
for
What an
having me.
awesome discussion. I feel like people will take so much from this and you bring such a great energy and expertise to this. So we are so grateful to have you.
Oh,
so
God,
thank
thanks
you.
for having me.
Of course. Episodes will be available every Thursday morning on Apple Podcasts, Spotify and YouTube. We're also on Instagram and TikTok at Smile the Makeover Scoop. So make sure you're following us on there. As I always say every week, please send in questions. Let us know what guests you want to come on. Anything you want to see on the show, you can DM us or email us. Next week, we will have a special guest. She's a business owner. We will talk about all things cosmetic tourism, building a business from the ground up, and beauty pageantry as well. So make sure you stay tuned for that. Thank you so much for joining in, and we'll catch you next week. Bye for now.
This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. Please consult with a professional for specific advice tailored to your situation.